Hello student, today we will discuss about minor disorder of male genitourinary system. Spermatocele. So cele means, as I said, collection. So spermatocele means it is a sperm containing painless cyst over the epididymis. So in the picture you can see the cyst is situated just above the testes and this epididymis is situated behind the testes. So here you can see the cyst. So what may be the causes for cyst? Exact causes is unknown. Some research suggests maybe blockage in the tube. So what is the main function of this epididymis? Two in number, left as well as the right side. So this epididymis will carry the sperm. So any tube blockage, the sperm will block there itself and it form the cyst. What may be the signs and symptoms? If the cyst is small, it is a asymptomatic. If the cyst is big in size, there will be a pain, heaviness in the testes. If it is a cyst is very big, when it causes signs and symptoms, it's required surgical removal of that cyst. Okay. Next, let me see varicocele. Varicose means it is a vein. Cele means it is a collection. So, it is a enlargement of the veins within the scrotum or collection of abnormal enlargement of veins within the scrotum, also called scrotum varicose vein. So what may be the causes? Exact causes is unknown. Some research suggests malfunctioning of the valve of the veins. So what is the main functions of the veins? The blood circulation. Blood will circulate in the veins. So at the end the valve will be there. Valve means it is an opening. If that opening is narrowed or it's not functioning properly, what happens? The pooling of blood will take place inside the vein itself. So it will be enlarged. The vein will be enlarged. So what may be the signs and symptoms? Pain and discomfort, mass in the scrotum. When client touch, there will be, he could feel that some kind of a mass. So it leads to discomfort. So see, this varicocele itself leads to complication. There's a oligospermia. So due to that veins are dilated, the testicle will not grow properly. So it leads to oligospermia, means less sperm production. So due to that, the man is having infertility, means he is unable to give child to his wife. So in such condition, he will approach the doctor. When doctor assess, through the doctor assessment also, sometimes doctor will diagnose varicocele. So treatment, in order to correct that, the treatment is a varicocelectomy, means remove swollen veins inside the scrotum and repair, making proper the valve, what is not malfunctioning, or when it is not proper, making it proper. So through this surgery, that sperm count also will increase and the problem of infertility will also disappear. So after the surgery, as usual, the client will be treated with a painkiller or this. Sometime if indication of any like infection is there, means with the antibiotic, and a complete bed rest for few days is required. Okay. The next is a epididymitis. Tis means it is a inflammation. So it is a epididymitis is inflammatory process of the epididymis. As I said, epididymis, two in number, left and right, is situated just behind the testes. What are the causes? The epididymis is always secondary to an infection. Secondary means already the client is suffering with some kind of a bacterial or a viral infection. So due to that infection, the client is getting epididymitis. That is a sexual gonorrhea, syphilis, and a non-sexual maybe UTI, urinary tract infection, prostatitis, inflammation of the prostate gland, mumps caused by virus, tuberculosis. So due to this, the client may get epididymis. What may be the signs and symptoms? If the condition is a severe, the scrotum will be swollen and when it touch, it will be a very warm. Testicular pain will be there, discomfort will be there. Pain while passing urine, urgency to pass urine, urge to pass urine every often. What may be the treatment? Since it is an infection, it is treated with the antibiotic, analgesic, use of ice pack, and bed rest with elevation of the scrotum, avoid intercourse with the partner. If he has married means, of course, until completely his infection reduce, he has to the client has to avoid the intercourse, as well as after that for some time when he is having a love with his partner, he has to use the condom. Okay, one more small disorder we will discuss, that is a hematocele. Hemato means blood, cele means collection. So abnormal collection of blood in between testis and tunica vaginalis. So what is tunica vaginalis? It is covering membrane of the testis. So the testis is covered by tunica vaginalis. So in between that the blood is collected. So how come is that? Means the hematoma will be there, clotted blood due to trauma, injury or accident. If it is very mild means by itself it is dissolved. It is not required any treatment. Okay, watchful waiting is required. But if it is a very big or it causing like any kind of signs and symptoms, like usually it is a painless only, but if it cause any signs and symptoms means the treatment is required. That is a drainage of that hematoma, means removing that blood clot after removing painkiller. So these are the minor disorder, and remaining we will see in a next video. Thank you, student.